Hi, my name's Elissa. This is my physical assessment part 1. I'm going to be having Mr. Hammond assist me. Mr. Hammond, during your assessment, I have to put my hands on you. Is that okay?
Yes.
Okay. I'm going to start with Mr. Hammond's appearance. His stage of development and growth is appropriate for his age and gender. His overall health, there is no signs of distress. Looking at him, there are no striking features that stand out. His hygiene and grooming, he's clean. His head, his skin, his nails are clean. There's no foul odors. His behavior, he's aware. He's acting appropriately for the situation, and he's not being combative. Communication, he's able to answer questions and respond to demands. We're going to move on to his skin. His skin, the color is white. There's no discoloration. There's no signs of jaundice or reddening. His overall skin is whole. It's intact. It's dry. There's no lesions, and it's smooth. Then we're going to move on to his hair. Mr. Hammond doesn't have any hair. From the visual of seeing where his hair would be, there is no signs of balding. His scalp is intact. There's no lesions, and there's no signs of parasites. I'm then going to move on to Mr. Hammond's hands and to his nails. Can I see your hands, please? His nail color is transparent and pink. His nail shape is rounded. The texture is smooth and thin. He has a 160-degree angle nail bed. And there's no discoloration. Next, I'm going to move on to his range of motion. The range of motion I'm going to have you do, you're going to have your arms in front of me and you're going to pull them down and then, or lay them down and then bring them back up. Okay, and you're going to take your legs and you're going to kick them out and bring them back in. Okay, so we're going to do that again, only this time I'm going to palpate. I'm going to kind of squeeze your elbows and then squeeze your knees while you move in that range. Okay, and go. Okay, was there any pain?
No.
Okay. Was there any pain?
No.
Okay. When Mr. Hammond came in for his assessment, I noted his gait. He was not stumbling, his head was leading his body, and his arms were swaying. Next, I'm going to check Mr. Hammond's tone. So with your tone, I'm going to have you push against me, and then you will pull against me, you'll push against me, and then pull against me. Okay? All right. And then push. Okay. And then pull. Okay. Push. Okay. And pull. All right. So I grade that a 5 for both. I am going to check Mr. Hammond's temperature of his skin. I'm going to use the back of my hands. I'm going to check his upper bilateral extremities and his lower bilateral extremities, and they're both warm to the touch. Next, I'm going to check Mr. Hammond's perla. So what I would do is I would look at Mr. Hammond's eyes. I would check his pupils. They're rounded and the same shape. I would then dim the lights. I would take my light pen and I would take it into each pupil to see if they restrict. And both of them restricted. I'm then going to check his mucous membranes. If you could, Mr. Hammond, pull your eyelids down. Okay, I'm going to check inside your mouth. Okay, so his mucous membranes are wet and pink. Next, I'm going to do a combination test. I'm going to hold my pen in front of Mr. Hammond. I'm going to have him focus on something and then focus back on my pen. Okay, so what I'm going to have you do is I'll have you look at the lamp and then back over at my pen. And then back at the lamp, back at the pen. Okay, so his pupils did react, so he does have perla. Now we're going to have Mr. Hammond balance. So Mr. Hammond, if I could have you stand up. What I'm going to have you do is put your hands to your sides. You're going to close your eyes and lift your right leg. Okay. And then I'll have you lift your left leg. Okay, perfect. And you can sit. Okay, so I would check for swaying, if there was any indication of swaying. If there's slight swaying, that's normal. Okay, let's go down to the striking, behavior, hygiene. Okay, color, temperature. I'm going to check Mr. Hammond's turgor on your skin. Okay, it was less than 3 seconds and it returned and there was no discoloration. There was no lesions on his skin. Okay, and that is my skill complete.